With advancements in treatment, the chances of surviving prostate cancer have dramatically increased in the last 30 years. Well, here to share more about the importance of knowing the signs and getting screened is Dr. David Marshall, professor of urology and chairman of the Department of Radiation Medicine at MUSC. Glad to have you with us.
Thanks. Happy to be here.
And it's amazing to see how just 30 years ago, survival is not what it is today. That patients that have been diagnosed with prostate have a much higher rate of survival.
That's right. So if prostate cancer is caught early, the cure rate is very high, and the 5-year survival approaches 100%.
It's incredible.
So it's really important to get, if you're going to be diagnosed with prostate cancer, to find it early.
Certainly. And what are the signs? What are some of the early signs that people should
That's the thing. There are really no signs
Oh.
that one has prostate cancer. That's why the screening process is really important. And so that's what September, as Prostate Cancer Awareness Month, is so important, is to get people out there to talk about screening.
Well, and that's the thing. So we've talked about this before, but getting men to the doctor's office, they ignore the signs, even if there are any, and they don't like going to the doctor. There's something that their barrier, like an invisible barrier to get them to go to the doctor.
So there's a lot of reasons why that can happen, but the important thing that I try to remind people is just a blood test.
Yeah.
At this point, you can just do a blood test. No more than that gets you started on a prostate screen, so a prostate cancer screening. So, it's that easy. You just talk to your primary care doc about, hey, what's this I hear about prostate cancer screening? I'm 50 years old, my father had prostate cancer. Should I be screened for prostate cancer? That's all it takes, and then you just do a blood draw and the test comes back, and then you go from there.
I think what a lot of men are fearful of is the digital test. So do you still do that, or?
So it's part of the screening process, but it doesn't have to be. So, guys are, patients are in charge, right? So screening can be just a PSA, because that's going to catch the vast majority of prostate cancers before they get big enough to feel.
Sure.
So the PSA screening blood test is good enough to get started.
Okay. And once you have the diagnosis, what is the process of then trying to eradicate the cancer, and then the chances of that being in remission?
Sure.
Good?
So, the important thing is to catch it early, because some prostate cancers, we don't have to treat at all. We just watch. And so the last 10 years, we've learned a great deal about just observing closely early stage, slow growing prostate cancers that may never require treatment. So we don't even treat all the prostate cancers that we find.
Is that right?
That's correct.
I didn't know that.
And then if we do find cancers that are a little bit more aggressive, that need to be treated, then gentlemen have a wide variety of choices on how to move forward with dealing with it, including surgery or radiation therapy treatments that all have gotten better at curing the cancer and minimizing side effects as the years have gone by.
Is there anything that a man can change about his daily life that would less exacerbate the cancer?
Well, we don't know a lot about how prostate cancers, or what causes prostate cancers. The biggest risk factors are family history. So if one has a father or a brother with prostate cancer, you have twice as high a risk as somebody else to getting prostate cancer. You definitely should be screened relatively early, in age 45. Or if black men have about 70% higher risk of getting a prostate cancer than white guys. So black gentlemen, they need to be in their primary care doctor's office talking about prostate cancer screening at age 45, as far as I'm concerned.
Interesting.
Right.
Okay, so 45 is kind of the magic number.
45 for people with risk factors. Probably 50 if you don't have a family history and you're not African American. You could probably wait till 50.
Oh, okay. But you say that even if someone has been diagnosed with the cancer, it doesn't necessarily mean that you're going to be getting treated for it.
That's correct. So what we've learned is we can avoid a lot of side effects of treatment if we just watch the really earliest, slowest growing cancers that may never cause a problem.
I see. Okay. And prostate cancer is fairly common, isn't it?
It's extremely common. It's the most common cancer diagnosis in men. There'll be about 300,000 gentlemen a year in the United States diagnosed with prostate cancer, and about 5,900 in the state of South Carolina.
Yeah, and I know we were talking about the fact that there really aren't any signs, but is there anything, let's say, unbeknownst to the patient, that the cancer has grown? Are there any signs later on that really would indicate them, you know what, I got to get to the doctor?
Well, sure, and they go along with other types of cancers that are genitourinary tract. You could have blood in your urine, or you could have a lot of trouble emptying your bladder, things like that.
Okay.
So those are later signs of the progression of prostate cancer and other types of cancers.
I see. Okay. Well, you've given us some wonderful information. I certainly hope that everyone hears this and heads out to the doctor. Just go for that checkup anyways,
Exactly.
right?
Get screened.
Get screened, everyone. Thank you so much, Dr. Marshall.
Thank you.
Appreciate your time. We're back after this.